some severity of the condition.
Oh.
Yes.
Do we have anything in your vocabulary concerning eye defects and diseases incurable?
I would not say incurable
Okay.
per se. I would say maybe you can delay progression of some of those diseases, but of course some of them are incurable. But maybe you can delay their progression. You can help control how they start from childhood. You can control the way you eat, your diet, to help prevent that concept of incurable.
Now, having learned that, what could be the major causes of defects or diseases?
Some of the major causes of these defects and diseases could be the environment you live in. If you're living in this dirty environment, you're more likely to get an eye infection.
Okay.
Some things like your family history. Some diseases run in families. For example, if we say maybe glaucoma, it could run in families. Some of the systemic diseases people get as they grow old, like diabetes mellitus, hypertension, age. When you're at a certain age, 40 and above, you're more likely to get these diseases. Yes, and not wearing your protective equipment, depending on your work environment. Some work environments require you to have personal protective equipment. So that could also lead to some diseases, the injuries.
Yes, I've heard that some research concerning work places, how they can affect our eyesight, concerning depending on what we are doing, especially people maybe who are builders, welders.
Yes.
Man, sometimes I fear for those people because, I mean, you see this fire, it's sparkling, and almost people are barely having nothing on.
Yes, yet they should be having something on to protect the eyes. Those in industries, those chemicals, when they enter
Quarries.
the eye, they could affect the front surface of the eye, which is supposed to let light enter into the eye, and then you end up having a scar at the top of the eye, and then you're not able to see. Yes.
Wow. Maybe this answers the question, who is at risk? Or everyone is at risk of suffering from eye defects and diseases?
Everyone is at a risk at a certain extent. The better health you maintain, the better for you.
Okay. For instance, you talked about the lights, which are this studio, and you're like,
Yes.
there's too much light here.
Yes, I told you this light was very, very bright.
Really?
Yes, and it could affect the eyes. You know, these lights, as they come into our eyes, you're increasing the chances for the eyes to become dry. I've noticed you're also focusing on you're doing a lot of near work, a lot of focus without doing a lot of blinking. That could make your eyes dry as well.
Are you sure?
Yes.
Oh my goodness. Well, I thought, okay, now this goes back to us. Now, actually, we are guilty now because we really rarely blink, because you have to stress the point, looking into this camera, just the way I'm looking at it, and you're saying that this one is not right, so you have to blink at some point.
Yes, you have to try to blink more often. You blink more often to allow tear exchange in the eyes, to avoid them from getting too dry.
Does this
And then
justify
create eye strain.
the advantage of women? They cry when they're happy and they cry when they are sad as well. Could women be having a strong eyesight? That research needs to be done,
Yes,
honestly.
that research needs to be
Because
done.
women cry anytime, and you're like, So as men, you've been told to be strong. You don't cry. You're not a girl. So that means that even tearing is very vital for our eyes.
Yes, tearing is very vital, but also if you're tearing too much, that's also not good. You come into an eye clinic and find out what is causing the tearing of my eyes. Why are my eyes tearing very often? Yes.
People who spend most of their times on gadgets, computers, TV, talk about those. How problematic are they heading to, or how are they?
You know, most of these gadgets, you're using them like this.
Exactly.
At this very near point near you. So some people are on them like 24/7, or their nature of work requires them to be on the gadgets 24/7. So that could cause eye strain, could cause dry eyes, could cause headache, could cause redness of eyes. So we advise that you get something to protect your eyes, maybe glasses with anti-glare to protect you from this light. Another thing you can do is rest your eyes between looking at something near and something maybe 20 feet away. So 20 minutes of reading
My God.
something that's near you, you rest your eyes for 20 seconds by looking at something 20 feet away from you.
I normally use my phone for reading 24/7. Or during daytime, because we have to
Always on the
learn,
phone
we have to read almost every day.
Yes.
So now I see the friends here we work with in the newsroom. These guys are at risk. They're editing the news all the time. They're on computer. They're like this, not blinking, and
They're not blinking, they're not resting their eyes. Even the posture of the head affects you. You're like this the full time. You're not trying to rest. You should stretch a bit.
Now, besides the guys in the newsroom, there are also others in the control room. There are big screens. You need to get there and see. They're all the time. They're like this. They're looking what's happening. Is there a movie? Trying to edit this, trying to edit that. Oh my goodness, amazing stuff. So that means that everyone almost is at risk.
Yes, everyone is at risk.
Wow. Now, if everyone is at risk, could there be some common eye diseases and defects?
Yes, there are some common eye defects. Let's say for what we call refractive errors.
Okay.
We can start with short-sightedness. This is your inability to see things that are far from you. You can be able to see things that are near, but things that are far are a bit blurry or not clear at all. Then long-sightedness. You can see things that are far, but near, the vision is not very clear. Then what we call presbyopia. This is an age-related change from the age of 40 and above. Although some people, it can come a bit earlier, maybe 38, 39, and that's what we call early presbyopia. So the lens in the eye no longer stretches enough for you to be able to read things that are close to you. So you see some people from the age of 40 pushing their hand a bit far back to be able to see the things that they are reading. And they should come in, get the eyes checked, and probably need glasses to correct those defects. The short-sightedness, the long-sightedness, the presbyopia. Yes.
Okay, so what's that now? There is a picture I'm seeing, cornea. I read those things in way back in 1996. I'm seeing lenses, focal point. So what's this? That triangular thing?
That's the light coming into the eye.
Where is it going? I'm seeing that thing
So
which is like a mango behind.
It's going to the back of the eye, which is the retina, where the light is supposed to fall onto that part of the eye, and it's translated into the images that we see at that back of the eye.
Okay. Wow, so that's what really happens.
Yes, now you can see on that diagram for a short-sighted person, the light is falling before that back of the eye, the retina, the focal point where the eye is supposed, where the eye sees and where the light is supposed to fall. The light is falling before. But for the normal vision, you can see that it's falling where it's supposed to.
Okay. Now, where does normally the great effect happens on that picture?
At that focal point, that's where the great effect happens, where the images are translated. The light translated into the images.
Wow, amazing. So if nothing's done there, problems have come.
Yes, problems have come.
Ooh, amazing stuff there. So those are some of the common eye challenges which you've just talked about. Now, how do we manage our eyes?
So for this,
the management
for these eye defects that I've mentioned, one of the things you could get is spectacles.
Okay.
And those ones you don't buy over the street.
Hey, I thought I go
and
I find something and I grab it and man, this is looking cool.
No, you go, get your eyes checked. They find the prescription, because the prescription, it's not that me, you, the other person, we are all going to have the same prescription. No, we have different powers in our eyes. So you get them checked, find your measurement, and then you're dispensed glasses. You can also do the contact lenses, which are in market, to also help with some of these eye defects. Yes. Then for the diseases, we haven't yet talked about any of the diseases, but if we are to look into diseases, so we are looking at bacterial conjunctivitis, those are infections that affect the eye, inflammations of the eye. You may need eye drops to help correct with that. Some things could need, if it's as severe as possible, you could need surgery. Anyway, we are going to take our time. We're not going to rush anything. Since we're still laying a foundation, we have next week to come and dive into diseases are caused by what? Diseases are caused by many things. The germs in the environment we live in, viruses, bacteria.
Where do we find the germs?
Where do we find the germs? From the dirty places. You know, someone could have an infection already, then they touch that door. Now you come, you also touch the door, and you...
And before you know it, something is itching.
And before you know it, you've touched your eye.
Okay.
Yes.
Wow. So must we be washing our eyes regularly? Just to wash our hands?
You wash your hands as regularly as possible. When you're from the washrooms, you don't just touch the door. You wash your hands, open the doors.
Etel, are you not resurrecting SOPs for COVID-19?
But we should, to maintain our eye health, good eye health, to maximize our vision. Yes. Wow.
Now, today we are tackling, majorly, let's tackle the defects. Next week we shall tackle the diseases. Or you want us to carry everything right. Anyway, away from that, we've been talking about the management, how we can manage our eyes, because our eyes are manageable, right?
Yes, they're manageable.
It is not easy. You said one of the things is to keep washing.
Yes, your hands.
Because before, whether we want it or not, our hands will go to our eyes.
Yes, the hands go to the eyes. Yes.
So besides washing our hands, we could get some glasses.
Yes.
Must we? Okay, you said we don't need to go to streets. We can come to specialists.
Yes.
Like to Med Optics.
Yes, you can come to Med Optics Vision Center. It has quite a number of branches, and you get your eyes checked and find out what the problem is.
The problem, Etel, is that when I come to Med Optics, won't they say, consultation is 100,000? Then
no. The consultation is very affordable.
Yeah, because those things scare us. Before you know it, you have your budget of 100K. You're knocking some doors of, these optometrists, and when you get there, like 100,000 is for consultation. Then checking is 100,000. Now, after that, these glasses are for 200. But also we have to measure your face. And you're like...
No, you can always get something that is within your budget. Okay. And we're not just giving everyone who comes in glasses. Yes.
We first check.
To find out, do you need the glasses? No. You've come in with an infection, you're treated for that infection first before you go into the glasses. Yes.
Kakati galubindi zino zetulaba mu kikuubo ziri affordable 15,000 waliwo nezitali shade nga ziri ng'ezizo naye maani zinyuma ozambala obeera cool so ezo tusoke tuzesonyiwe
muzesonyiwe zino zishade zemugula ku street
naye batugamba nti shades zituyamba okuziiza omusana omungi oguva ku njuba.
Now you see, if you're not careful and you've not seen what's on the shades written, you may just buy shades, but it's just something black. You feel like it's decreasing the light.
I see SUV, something like that.
Yes, it's supposed to have some level of UV light protection,
yes,
ultraviolet light protection, and they could also be polarized. Now, when they have UV protection, they help you from that UV light that's coming in and will damage the eyes. You know, this UV light also causes what we call cataracts. The more that enters, you're causing damage to the lens
what
of
is
the
cataract?
eye. Cataract is when that lens of the eye that allows light to enter, instead of being transparent, it gets a bit cloudy.
Ensenke.
Yes. So
someone I've seen some people who's it's called the iris or the middle.
The middle.
Yes, and you're like, it's looking a bit
white.
Yeah, whitish.
Yes. And you're like, this one ensenke.
Okay. Is it curable?
It can be operated on.
You cut the eye?
Not me specifically. We refer you to a specialized person to do that surgery.
Okay.
That person is called an ophthalmologist. Yes.
Wow, so that's what happens in there. So we have to, if you want to avoid that, you have to be careful with your eyes.
Yes.
Now, are there some preventive measures? And this is what's going to take us to the break. So that's what we call cataract, right?
Yes.
But it is. So that one calls for an operation.
Yes, depending on the level at which it has grown, the severity. If it's too early, you may get glasses to help you for some time. But eventually, as it matures and the vision is worse, it can't even be improved with the glasses, you'll need to now go in for a surgery. Refer you to the ophthalmologist. He sees how far it is. Can it be operated on right now? Do you need to wait a bit? Yeah.
So once again, you say what causes cataract?
There are very many causes of cataracts,
okay.
But one of them could be UV light ultraviolet light that's entering into the eye. Some conditions that people have, like diabetes, they are more susceptible to getting these cataracts.
Okay.
Injuries to the eye can also cause a cataract. That's a traumatic one.
Omanyi ebibeera ku mikolo ffe tukola emikolo naye tugenda mu mikolo kati ng'okwanjula tugula ebintu bye tuwa ababuuza bane mwe bali kujja mwe bali kutwaniriza kati ebintu ebyo tugula nnyo galubindi as gifts etuziwa ndoga byambala masape nyume kumbe tetumanya ate naffe tucontributing oba twegasse ku bantu abonoona amaaso g'abantu
sinti mwegasse ku bantu
kubanga ffe tugula buguzi tetumanyi tetusoma nako ogula buguzi galubindi zolabye zirabika bulungi Ray-Bans nga zaakabi nnyo
ziyinza okuba nga they are just for fashion nga you just put on yes
naye abantu tebazijjaako emisana gonna oli asiiba na galubindi
ze kati awo oba otadde kintu kya black ku face now when you put the black the window that allows light in the eye opens wider. Now all the light is entering in. If it's just a normal shade and it's not UV light protective.
Okay. Yes. Abayimbi bajja nnyo owayise ku show ng'eno nga baggaddewo tulina okuggalawo njogera ennaku zino gitegeera ekyo kinengeri kibakosaamu obulamu bwa bwonna ebiseera bisinga baggalawo muba muli bwe nti ku show nga gaddewo very very dark shades
kiyinza okuleeta eye strain when you're not seeing enough. Now you're always seeing in a dark environment. So now you're trying to strain to see because you've put your shades on.
Atamba Adele is a metro optometrists.
Yes.
Amazing stuff. Wow, those jargons are those ones. Okay, we're going to take a break. When we come back, we're going to look at the preventive side. How can I prevent these eye defects? If, for those some of us who want to live up to 100 years, we have to keep this sight. One of the gentlemen whom I already see, his eyes, he's reading letters without specs. He's President Museveni. Sometimes I'm like, how does he do it? So we'll be right back and talk more about that.
Focus. Focus on Healthy Morning. Breakfast is the first meal of the day, usually eaten in the morning. Having a healthy breakfast is important because it replenishes your supply of glucose to boost your energy levels and alertness.
Reasons as to why you should have a healthy breakfast. It helps in having good cognition of the mind. You have good mood for that day,
while also providing other essential nutrients required for good health. These are some of the foods that a healthy breakfast consists of:
a protein, a fiber, and then a healthy fat. Not all fat is healthy. The protein, you can eat an egg. It is a good protein to eat. Then for the fiber, you can have something like a fruit or vegetables. Briefly, that is what is entailed in a healthy breakfast.
Better healthcare for a better tomorrow. That was the Health Minute.
Focus. Focus on Healthy Morning.
Good morning once again. Thanks for joining us. We are concluding our next segment in Focus, and we're tackling eye defects and diseases. Now, these are shades. Now, some of us, we don't know whether this can affect our eyes or cause eye defects or diseases, or they don't. And some of us, when we go to, shops or streets to buy these shades, we don't mind about the UV light, protective. How? So the doctor is here. Adele here is going to help us on this. Is this good or bad? She was saying that not all shades are bad. Now, I don't see anything concerning anything here talking about UV protection. What do you think about this?
Depending on where you got it from. I do not know where you got it from.
On the streets.
On the streets. At how much?
This could go for 20,000.
For 20,000.
Others at 50,000. But there are those who go for 150 or 200,000.
You see now when you are buying, they can have a budget for everyone. So you go knowing these shades, I need something that's going to protect me from the UV light. So you go and inquire and ask, where can I get shades that are UV light protective?
Because in Ichikubo, they may not know about UV light protection.
Yes, they may just even be selling.
They're just selling.
Yes,
I mean, these guys who are hawkers, they're hawking shades and making a living, and you're asking them UV lights, like, come on, get a shade, and it will alleviate you from stuff, too much light there.
Yes, those ones may not be light protective. And also, you may have your own prescription, but you're wearing shades, and you're still not able to see. You're thinking it's just the sunshine that is disturbing me.
Ekitegeeza galubindi zino ezimu zoonona amaaso naye nga si zonna okuggyako nga ziriko akantu kali UV light protection. Ako kake katukakasa
zibeera ne polarized nga kikulaga nti zino ziri polarized zina ne UV light
kati ekyo kindaze kikulu okugula galubindi zino oba ebintu mu bantu abamanyi kye bakola. Naye kakati ebintu bino ebiri cheap ebiseera bisinga 5,000 6,000
nga tomanyi kyogula
gogula buguzino. These are my shades.
Kafaana bulungi kanteekeko.
This will do me good. Before you know it, what it's doing, you cool, man, it is really devastating your life.
Light.
So people who are putting on this abayimbi kujja olina okusooka oggaleewoko osooka okangemu kati omala okkangamu awo so tubiraba nnyo awuli olulimi na this is what they speak. Anyway, so preventive, how do we prevent eye defects?
Some of them we can slow their progression, like I mentioned before. We can slow their progression. Others, you wear your personal protective equipment at your workplace. You avoid sharing medications with people. You know, when you go to the hospital, maybe you take your child, they're the one who has an eye problem, they prescribe for them medicine. Then maybe a week later, you're like, nange lisoli numa kantekeko akadagala k'omwana wange. Chokanga tomanyi why your child was using that medicine, or you don't know why the other person was using the medicine. And also people with systemic conditions like hypertension, diabetes, should take their medications as prescribed to prevent some of the eye defects that come from having diabetes and hypertension.
Waliyo mu Uganda waliwo ekizibu kye tuyita self medication kyeyongedde nnyo nti olwokuba tumanyi waliwo kibayita eye drops. Eye drop leeta ka eye drop ako ntonyezeemu tumanyi n'obbugula nga just gwogula buguzi olw'okuwulidde amaaso gakulumaalumamu. Kaakati waliwo n'ebirala abantu bakozesa. Waliwo omuntu yaŋŋamba amaaso gali gansiiwa n'aŋŋamba totawaana genda mu ddwaliro leeta ago amajaani mwana gwe gadeniti n'ateeka mu mazzi naaba n'amazzi agookya.
That is very bad. Very bad. That's like using traditional medicine to treat the eyes.
My goodness.
You don't know what's in the chemicals. You don't know the chemicals in those tea leaves that they are putting agamajani gatabudde n'ateeka mu maaso. It can damage this front surface of the eye. Then it brings a wound. In the healing process, it leaves a scar. Now light is no longer going through the eye, so that it can focus at the back.
Amaaso gano gali delicate nnyo nti gali too fragile. Omanyi tugenda tulowooza nga bwenkaluba engalo zino na amaaso nago magumu nnyo gali too fragile nti kantu katono nnyo gasobola galeetera obuzibu gonoona something like that.
Tekabeera kantu katono nnyo, but as soon as you realize that I've put this in my eye, or something has fallen in my eye, you may not have put it yourself, but something has entered your eye, you go as fast as possible to get it checked out. If it's a chemical, immediately you just wash the eye as soon as you can. As on your way to the hospital, you wash the eye. Wash the eye, put water in the eye.
Okay, kasita nfunawo akantu konna kati waliwo bano abantu b'ewaffe ewaffe eri tufumbisa nku kakati nku olina okukumamu kati obuntu obwo bw'oblowinga bw'ofuuwa obwo buyinza obuliro okugenda mu maaso kati ekyo kibaawo nziruka budde sinefuna amazzi nga tegaliimu kintu kyonna tegaliimu sabbuuni.
Yes, temuli sabuni. Nga temuli sabuni, just get water and you wash the eyes as you go to the hospital to check it out to see is there any further damage, because you don't know how bad is the damage until someone else has checked and told you that. That's why we are. And then also we also advise you do an eye exam every year, at least once a year, to check the status of your eyes.
Kati kitegeeza bwe tuva wano tugende ffenna ku medoptics.
Tugende ku medoptics tukebera amaaso.
Kati byonna bisasulidde. Now jjajjange yayogeranga bw'ati yamba muzzukulu oze okusa oli awo osumagira busumagizo ganya okunaaba amaaso, bw'oba onaaba amaaso naabisa sabbuuni era nga ku makya bwe tukeera tukuba ekyovu n'oteeka mu maaso tunaabisa kyovu ekyo.
Kati awo oba otadde ku feesi muba munaaba feesi
nga tugenda ne bitubalagala
ne bubalagala
sabbuuni ng'atugamba alina okuyingira mu maaso.
Kati olaba ezo chemicals tomanyi kiri mu sabbuuni what's going to damage the eyes.
Oyinza okulinaaba Carolite ate nagenda
n'adema eriiso
n'adema eriiso anti yagira sikiri ate yotaga liiso nga balibuusiza. So okay, now what are the myths and misconceptions?
One of the myths would be that wearing glasses spoils the eyes.
I've had that for all my life.
It does not actually spoil the eyes. In most cases, when you've now gotten glasses, you've checked your eyes, you put on your glasses, your brain is now seeing something clear. Kati you take them off and you're like, I can no longer see without my glasses. But now your brain is also used to seeing good things. Naye kati goyagala kuddayo olabe nga toyina gaaluvindizo. Ate ekirala okulowooza nti abaana tebasobola kwambala gaaluvindi. Children can wear glasses as long as they have an eye defect, they have been checked and they have been prescribed and dispensed those specs that they are wearing. Yes.
Obulwadde bw'amaaso kati nga ensenke cataracts teri baddogo. Lirwana ndogako manyalaba nkulaakulana nnyo ebintu byalina n'akasereke akasiisira kange. Nze mbadde manyiri baddogo omulaba omuntu ng'alina amaaso agali teri baddogo.
Teri baddogo. It's just a change in the body, could be age. Some people are born with cataracts. Yes.
Kakati ani alina okwambala galuvindi ani atalina kuzambala?
Omuntu gwe bakebedde ne bakugamba olina weetaaga galuvindi ng'ozambala. Bw'abanga bagambye tozeetaaga neera nga bakukebera ne bagamba nti teweetaaga galuvindi.
Kakati ffe ng'abakola wano nga bw'olabye amataala gano ate nga gano matono kuba balina okwongeramu times 10 times. Kino kitukosa twetaaga galuvindi?
Muyinza okwetaaga ez'okuba protecting from this light or maybe they find a way to set it up in a way that it's not bright and entering directly into the eyes.
Kakati wekibanga wegatyo galina okubeera tulina okufunayo galuvindi
to protect from that bright light. Yes, with
light ennyingi ekosa amaaso.
Light ennyingi ennyo ate n'entono nnyo naye ekosa kubanga kati otandika okustraininga.
Straining kyeki? Nga bw'onoogera kati kangeze producer nyambeko nga bw'onaabeera bwenti nga nina amaaso ninga agafunyaafunya bw'atyo
ng'ogafunya
ninga nga eyeekaka
okulaba ate light eri ntono nnyo.
Kati abantu abamu baba n'amasimu ne bakendeeza kalayiti kati naaba ng'ali bw'ati ng'ayagala kulaba tabiraba bulungi. Kakati kino nakyo si kituufu kaka amaaso.
Kaka amaaso. Ate myth endala abantu balowooza carrots zi quick fixing a vision yo. It's okay to eat carrots.
Preventive.
It's a good practice to eat carrots. It's like healthy living, eating healthy, exercising. Yeah? But when you have an eye problem, that eating carrots there and then is not a quick fix for your vision.
Carrot teziwonya naye ziyamba ng'omuntu abadde talina kizibu ekyo okusigala ng'ali mulamu atambula bulungi amaaso ge malamu.
They will not magically give you the night vision. Yes.
Waliyo myths yo n'endala ne conception okuwubisibwa kwonna?
Kati waliwo abantu abambala contact lenses balimu abalowooza nti balina ozeebakamu oba n'okugenda mu kuswiminga nga bazambadde oba ogenda kwebaka olina ozijjamu abalina zi contact lenses balina ozijjamu nga bagenda okwebaka.
Contact lens kyeki?
Kabeera katini nga kalimu lens n'okateeka ku liiso bano abatambala galuvindi naye nga bazeetaaga.
Mu firimu ne mu bazanyi b'emipiira mu bazanyi b'emizannyo mbalaba baddira kalinga nga kabubi kenkana nene munye akakwata bwati n'agira bwati n'akasaamu kebayita contact lens.
Kebayita contact lenses. Ate waliwo nezo ez'okulabika bulungi eza kala nga oba oyagala amaaso gabeera aga green oba gabeera aga black nezo togenda n'ozeebakamu oba ogenda kwebaka ng'ozijjamu n'ozicleaninga bulungi.
Kati okay tuddeko katono ku management. Kati wemba ngenda okwebaka nina kusooka kunaaba maaso oba ne wengenda obugenzi nze nvudde eno ku mulimu kati waliyo abantu abamu ng'okunaaba kuba kalubiriza yanaabye ku makya ate kyekimunaabye ekiro.
At least onaabako engalo.
Balayi
kubanga the first thing you do in the morning when you wake up most people used to touch their face, touch their eyes. So now you've left work. Now imagine you're working in an industry where you're touching chemicals. After you've left work, you're tired, you just sleep. In the morning you wake up, you touch the eye, you're like, hey, my eye is burning, what's wrong with the eye? Now the chemicals you left on the hands, you are not even wearing your protective equipment to prevent that problem.
Abakyala muba nnyo ne bimukozesa bingi waliwo ka misti kano waliwo ka oiro kano waliyo akazigo kano kati weerabidde oba bikozesa bwoti ogenda otuukira butuukizi mu liiso.
Irritation. You can just wash your hands, wash the eyes. Yes.
All right. Okay. Amasimu producer gatuwe bw'oba olina ekibuuzo ky'obuuza ku maaso ku essimu otuwulira amannya go gy'okubidde n'ensonga kibuuzo kikyobuuza ku maaso then omusawo ajja kuddamu akutegeeza kikyolina okukola n'amaaso go. Otugambye nti galubindi tezoonona maaso ekyo nakyo twakirowoozanga nnyo. Mwana ono atandika okwambala galubindi amaaso gano ganaddamu okulaba ate twalina n'ekirala bw'olaba omuntu alina galubindi oyo aba talaba kyokuyaba wa lugezigezi nnyo. Kituufu abambala galubindi balina olugezigezi?
Nedda si kituufu. Omuntu aba ddala ng'ali eyo talaba bintu birungi nga yeetaaga galubindi ze. Kyokka omuntu amugamba olina olugezigezi kati n'atandika ozijjako kati abonaabona atabiraba bulungi.
Okay. So kyandibadde kirungi nga tonnayambala galubindi zonna sooka ogende bakukebere. Kyandibadde kirungi galubindi zino zoyagala okussaako naddala ba artist zino ze mwagala ennyo bwe ziti gy'ozigula wakulu olina okulabako UV ultra
olina olaba nti ziri UV light protective ziri ne polarized.
Okay. Polarized kitegeeza ki?
Polarize kwe kuyamba okulaba those specific things
nga tokaka maaso. Waliwo galubindi nga bw'ozambala olaba nga kka ng'otambula wantu wali street naye ng'olaba nga alinnya mu kinnya galubindi zino.
Kati oyinza okuba ng'oyambadde na galubindi nga sinazizo kaza muntu omulala bipimo bya muntu omulala.
Bwe nyambala galubindi z'omulala zisobola nazo okundwaza amaaso?
Iye zisobola okuba nga kati otaddeko galubindi z'omuntu omulala kati otandika okuwulira ng'omutwe gukuluma kubanga pawa y'oli ey'omu maaso si yeeyiyo. Kati gweotandika eyo nowulira nti amaaso geesika.
Alright. Badde manyi nti libadde og'omulirwana abangi. Okay. Alright. So amaaso buli muntu yenna asobola okugalwala. Omuntu asobola okwewala okulwala amaaso?
Asobola okukola ki?
Okwewala okulwala amaaso.
Asobola okwewala okulwala amaaso.
Mbadde ndaba nnyo President Museveni jjajjange ng'asoma speech tataddeeko galubindi ne nga ne omusajja ono. Omusajja oyo musajja mukulu mukadde naye nga tataddeeko.
Kati some people oba ng'oli short sighted bw'otuuka age of 40 bw'ojjako galubindi zo oba osobola obiraba by'osoma.
Okay. Hello, caller. Hello. Hello?
Hello.
Ye Nyabo.
Good morning.
Good morning. How are you? What are your names? Where are you calling from?
My name is Rukaya.
So your name is? Lukaya.
Yes.
Where are you calling from, please?
Rukaya.
Yes, where are you calling from?
Yes.
Would you please...
I'm calling from Gayaza.
Okay, what's your question? Please turn down the volume of your set.
From Gayaza.
Okay, yes, please. Go right ahead. Yes, Lukaya, please go right ahead. Lukaya? Oh, okay. Please, when you call in, turn down the volume of Bethany. That will have really proper communication. Otherwise, there'll be feedback. Ojja kuba weewulira. Nkimanyi it feels good. Oba oyagala okuba essimu nga weewulira ky'oyogera. Naye ate eno kiba kikola bulala. Kiba kikuddiza eddoboozi lyo ng'ate weewulira nga totuwuliziganya bulungi. Katufuneyo omu. Please, oba olina ekibuuzo kyonna ku maaso, ng'olina kyagala okubuuza omusawo bw'ali okwanukula. Just bw'okuba essimu amannya go ne gy'okubidde n'ekibuuzo kijja tukola bulungi. Hello, caller. Hello. All right. Yes. Omuntu asobola okwewala tuba twogera ku muntu okubeerawo nga tayambala gaalubindi obulamu bwe bwonna n'aweza n'emyaka 8 ng'omulaba alaba bulungi atambula buli kimu akiraba ne mukizikiza.
Kulya bulungi, exercising, doing annual checkups to find out the status of your eyes.
Otugambe buli mwaka twandyekebezaayo wakiri.
At least once. At least annually. At least omulundi ogumu kumanya status. Yes. Even if something comes in between that year, you come back and they check your eyes.
Ntera nnyo gamba abantu nti ky'omanyi tekisobola kutta. Ky'otamanyi kye kikutta. You die silently. Kubaka kati abantu batya okwekebeza. Kati ekintu ky'otamanyi. Because once you get knowledge about something, it can't harm you. But once you're in ignorance about something,
and
it will
you
really
don't know about
exactly
it, it will harm you.
Pose great threat to you. So kikulu nnyo okwekebeza mwakiri omulundi gumu. Ebintu bino bannange bikulu. Wano tuli ku preventive measures. Osobola otya okwewala. Gy'okoma okufuna okumanya. Oba ofuna bulamu. So genda mu ddwaliro bakebere. Era weewale tulina mikwano gyaffe nga basawo nnyo b'amaaso nnyo okusinga nammwe. Ekyo nakyo kireesa obuzibu. Agira bugezi bw'oti kwata ennyaanya ofune supu w'ennyaanya omwana mutonyezeemu. Abantu bali bawadde abantu amagezi ku maaso. Ikola bw'oti genda otunule mu toilet bw'oti gajja kuwona. Kutidde. Abantu bali eyo beefudde abasawo. So bw'oba oyagala ekintu kyonna noonya omukugu. Hello, caller. Hello, Sebo. Sebo, erinnya lyo okubiddewa? Wanji? Hello? Okay, our lines are having some technical challenges. We'll rectify that. Sorry about that, callers, and those who are watching. Yes, twagala kumaliriza program eno. Kiki ky'owulira kyewandigamye nti kino buli muntu yenna alina okukimanya ku maaso? Dr. Edel.
Buli muntu alina okulabirira amaaso ge.
Okay.
Akebeza amaaso buli mwaka. Anaabe engalo. Someone should blink more often, especially people who use a lot of screens and doing a lot of work that requires concentration. Those who are at workplaces that require you to wear personal protective equipment should put them on to avoid blinding eye conditions. You should put on your personal protective equipment. You should rest your eyes more often. 20 minutes of reading. You look at something 20 feet away from you for 20 seconds to rest the eyes more often. Yes.
Waliwo abazadde nga tebalina budde. Omwana bamugulira taabu ne TV. Omwana abeera bw'ati. Kuliko katyuni. Eno bwe kirya ne kinywa. Tatemnya ali ku TV bw'ati. Omwana oyo alina obuzibu. Maaso obumwolekedde maaso eyo.
Waliwo obuzibu kubanga waliwo kye tuyita short sightedness. Abaana emyaka emito. They are at high risk. Those who do a lot of near work at high risk of getting short sightedness. Yes, and those who are already born with it, and the parents have not even taken them for an eye checkup to find out, and they're also doing a lot of near work, not spending a lot of time outdoors playing around, could now increase the progression of that short-sightedness that they already have.
Okay.
Yes.
Waliwo abaana abalala bakola prep ekiro enkya bamuwadde home package bakomyewo abazadde ekiro saawa emu balina okukolawo akabambi tekiraba na bulungi kiri mu kkola eno maama wakigamba kola gwe n'abayizi abali ku ssomero basoma ekiro hop preps light ezo tezitera kuba nga zimala beekanga nga bastraininze oyinza bbawo amagezi ki amasomero.
The schools that they are in, actually the schools can integrate a program where they call up doctors to do eye checkups or screenings for the pupils in the school and give feedback to the parents.
Okay.
And I think they could also look at their setting up of the preps. The lights, they should be enough, and they should also not be too bright that the children are affected and they are strained by the lights that they have installed in their schools.
And those Medoptics naffe Bethan TV tulina okgendako mu masomero tusomesa abantu amasomero ago tubabuulire obuzibu kubanga abaana bafuna ebizibu nga tebamanyi. Waliyo endwadde z'amaaso nnyingi nnyo ate ffe edda bwe twasomeranga ng'obulwadde bw'amaaso bwe bujja ate musanyuka busanyusi anti mufunako obudde ewaka mufuneyo ku obitegeera so era nga waliwo red eyes ezo diseases trachoma bikiwe byajjanga ng'oyagala abasinga gankwata ne banzizaayo keeka nenfunayo kande so that was a lot. Anyway ndowooza tetusobola kusukkawo wano mpozi nga waliwo ensonga yonna naye netwogedde ku diagnosis ne treatment.
Kukebera amaaso, go into detail.
Okay, details. Kati kitegeeza tunaakomawo next week tujja kweyongerawo nnyo awo naye nze kyentutte ewaka naddala kuba nkiraba nnyo ebintu ebya layisi bya bbeeyi. Layisi agula buwanana mugula enankani zino ne muzambala naye mugenda okulaba nga ate amaaso gatandisa okufuna obuzibu naddala nga tugenderedde dokita atugambye zino okubeera polarized. Olina otutunulira UV protection ku gundi zino tokwata bukotwasi nti omutembe abadde atunda
ate no babo bakwata ne bustika ne babuteekawo buteesi obwa UV nolowooza nti nguze ka UV nga bwe bangambye
asobola okutunda.
Olina ogenda gye babiraba bulungi ng'ogenze n'obuuza sheds nga bamanyi kye bakola. Mubigulira nnyo abaana abato ku birthday zaabwe sima bambala ebintu abalala muzironda mu kkubo n'ogamba mugiteeka n'ogamba maama erondedde galubindi kangene nyambale kumba otutte bulwadde. So kikulu nnyo okwegendeza. Doctor, sekendi 3 kankwongereyo sekendi tunula mu kamera eyo maliriza n'ekisembayo. Ekisembayo buli omu yeetaaga okebera maaso oba mwana muto oba muntu mukulu nnyo oba ba teenagers ne waba baby imwetaaga obakebera amaaso mulabe oba gali bulungi. Is the eye health good or is it bad? Do you need anything to maintain your eye health? Is a doctor advising you to do something specific? Everyone needs to do an eye exam.
Tuyanziza atamba edal omukugu w'amaaso gwe tubadde naye leero nga twogera ku ndwadde n'ebikosa amaaso. Tujja kumweyongeza next week ate tujja kusaawonyesera kuba waliwo abantu abalina ebizibu by'amaaso bingi. Erinnya lyange nze Kintu Muteesaasira senior. Katusinkana olunaku lw'enkya ssaawa ze zimu obudde bwe bumu. Katonda abakuume ate weekuume.
Focus on healthy morning.